Hi, welcome to Grandpa's Underworld, and I'm Grandpa. Tonight we're going to tell you about some of the weirdest medical practices that happened before science came in and found a better way. There have been plenty of weird medical practices. I think one of the weirdest practices was how quickly they would release the medications without knowing the side effects. Not only did they market them into the world, but they did so in a way that made them seem perfectly safe. Child teething. Just give them some morphine. They made a soothing syrup for babies that contained 65 milligrams per ounce. Moms everywhere loved this stuff and raved about how quickly their children fell asleep. It was taken off the market after being dubbed a baby killer in 1930. The American Medical Association had been publishing articles as early as 1911 as how dangerous it was. The slogan was, oh my, it will cure any animal or human. Then while making codeine, the man who made it accidentally made heroin for your cough instead. Would you like to have cocaine for your toothache? Although this actually makes sense, cocaine actually does have a numbing effect, and the use for it, tooth pain led to the birth of Novocaine, which we all use today. In the early 1900s, the Dr. Henry Cotton developed a new theory for the cause and cure of mental illness. He said that mental illness was caused by infection. He called this auto-intoxication. Cotton felt that teeth harbored infection. This infection then caused the patient's mental illness. To cure them, he would extract some or all the patient's teeth. If the patient was not cured, he moved on to other organs. Tonsils, adenoids, spleens, ovaries, cervixes, gallbladders, stomachs, testicles, and colons would be removed. Dr. Cotton claimed an 85% cure rate. He did not speak of his 30 to 40% mortality rate. This was before the invention of antibiotics. He was honored in the United States, United Kingdom, and Europe. People begged him to treat them. He was medical director of the New Jersey State Lunatic Asylum in Trenton, New Jersey, in June of 1922. The New York Times wrote of Cotton's published lectures at the State Hospital at Trenton, New Jersey. Under the brilliant leadership of the medical director, Dr. Henry Cotton, there is the most profound scientific investigation that has been made of the whole field of mental and nervous disorders. There is hope, high hope, for the future. So confident of his cure, he had his wife's teeth removed, the teeth of his two sons as a preventative treatment, and he removed some of his own teeth. His staggering body count made him a controversial figure. Cotton eventually lost his post as clinical director at Trenton. He was allowed to remain as the director of research. Dr. Henry Cotton died in 1933 of a heart attack. Okay, how about making fertility drugs from the pee of Catholic nuns? In the 1950s, scientists knew that women entered menopause. They released fertility hormones in their urine. So Dr. Bruno Lunenfeld wondered what if we could extract these hormones from urine and make pregnancy drugs? But where would he find the urine of older women? He and his colleagues got permission from the Pope to collect urine from Catholic nuns. He extracted high levels of hormones from the urine, and they are still used to make women pregnant. But now they can be synthesized in the lab. That's it for Grandpa's Underworld tonight. Don't forget to hit the like button. Please subscribe if you would. Hit the notification bell if you'd like to know when we do this again, and leave comments if you'd like. Thank you and have a good one.